Good evening, everyone. I'm Tony Paniagua. Welcome to Arizona Illustrated for Tuesday, June 7th, 2011. Earlier this year, when the new Congress was discussing the nation's budget, much was made about federal dollars being used to help different groups around the country, including Planned Parenthood. Many opponents say tax dollars should not be given to any organizations that perform abortions, but Planned Parenthood supporters say the group provides many other essential services. Tonight, we are joined by Bryan Howard, President and CEO of Planned Parenthood Arizona. Bryan, thank you very much for joining us.
Good evening.
So if you could put this all in perspective, this discussion that was had earlier this year about the funding and whether the federal dollars should be given to Planned Parenthood.
Well, I think the first thing to remember is that there were no dollars, there are no dollars, and there were no dollars going to support abortion care. That's been the law now for going on 4 decades. Planned Parenthood knows how to operate within the law. The dollars that we were talking about, and really I was in D.C. that last day of the budget debate. The dollars that were in question were about prevention. They were about annual exams for women, breast exams, pap smears, birth control.
So any idea why those would be under attack, if not directly, at least from another perspective, another point?
Well, there are some people who don't believe, not only are opponents of abortion, but some elected officials who oppose birth control. I also think that there is an energy around Planned Parenthood for some of the more extreme members of our legislatures, that they're dissatisfied that we're still here, still providing our full range of services in our communities. So I think it was frustration, and for some people, a genuine opposition even to birth control.
So tell us about some of those services. I know you are throughout the state, you have different offices, and what do you do, and how long have you been around here in Arizona?
Well, our major focus since the day we were founded, which last year was 75 years ago, has been prevention. We offer, our major focus is birth control, family planning services, so women and couples can plan when and how many children to have. We also provide breast exams for early detection of breast cancer, pap smears for early detection of cervical cancer, and testing and treatment for sexually transmitted infections, including HIV. That is the core of what we do. We do it in through 14 health centers across the state in 6 different counties. We see about 60+ thousand patients a year, and the vast majority of those are for the prevention-oriented care.
So obviously it seems like the goal is to prevent pregnancies, have people plan their families as opposed to resorting to an abortion perhaps in the case of an unwanted pregnancy.
There's really no medical reason in 2011 for a woman or a couple to be exposed to a sexually transmitted infection or to experience an unintended pregnancy. The medicine is there, if you will, a variety of methods of birth control, ways to protect yourself from contracting an infection. The medicine is there to keep yourself healthy. And that's our focus, is getting those services into women's and couples' hands.
And back to the debate about the federal funding, what percentage of that amount is used by Planned Parenthood, or does it depend on the federal government?
Well, in this state, about 15% of our budget is covered by federal funds, 2 programs, the Access program, Medicaid here in Arizona, and a specific family planning program. I think it's important to note that those funds are all the more important here in Arizona because ours is one of a very small number of states that allocates no funding for family planning services whatsoever.
So therefore they are essential, that money is essential for the organization.
We're really talking about the working poor. I think there are misconceptions about the kinds of people who need assistance to get health care. I was talking to a young man, a reporter for a rural newspaper last month. He was young, married, had 2 kids, and he's on Access. His newspaper doesn't offer health insurance. His pay level is low enough. He and his wife, they're the kinds of folks who come to Planned Parenthood, access care with the Medicaid dollars, and cuts that are planned in that area as a result of the most recent budget session, are going to put them at risk.
Oh, and briefly, if you could tell us about the future growth. I know you're opening up a new facility, you say, in Prescott Valley?
We have been investing in expanded health centers across the state for 5 years now. Next month, we will be opening an expanded health center serving all of Yavapai County in Prescott Valley.
Okay, Bryan Howard, thank you very much for joining us.
Thank you.